This is Dr. Nick Despotidis, and I want to welcome you to tonight's webinar. So tonight, I came up with this title, and I bet you if I said how to build $1 million practice, we'd get a lot more than a dozen attendees. But really, what I wanted to discuss, what is practice independence? It seems like as time goes on, we think it's just something we say, it's a myth, or is it really something that people are attaining? And my observation of being in practice for 30 years, practice independence is totally doable. It's a reality. I have several friends and colleagues who've maintained it, and hopefully I'll articulate the steps necessary for you to obtain it. All right, what initiated this talk was actually this article written by Melanie Denton in Optometry Times. I read this journal a lot. I think it has some really good practical information in it. I enjoy it. It seems like most of the authors there really are well-intentioned. They're speaking from the heart. They're telling us their clinical experience, and I read it often. And this article really, I don't know, Melanie, but it got my attention. It was titled something to the effect of getting off the hamster wheel. And I took a few quotes from her article. She said, instead of remaining hamsters, what if we get off and say no? What if we say, I will not dictate the care I give each and every patient, each and every day? Our time and full attention is what our patients need. I know I'm being idealistic, she says. As I work to set up my own practice, I can't help but be. I think we all can and should ask ourselves honestly, what are our goals? And I think these are strong statements. And I remember having these when I went into practice 30 years ago. I asked these same exact questions. So tonight's presentation, I'm going to walk you through what was my mindset from the beginning of starting my practice cold. And my thought process was very similar to Melanie's. In other words, from what I hear, even back then, people were telling me all the limitations I would have in private practice. And they turned out, a lot of them were false. And I'm here to say that there were many times in my 30-year career I felt like I was on a treadmill. And about 15 years ago, I decided to get off the treadmill. And I want to tell you why and the steps I had to take. And the benefits, the rewards I've reaped and my partners have reaped from getting off the treadmill. This is a book that was also recommended, and I read it. I've read it more than once, and I strongly encourage everyone listening to get this book by Sandip Juhar. He's a cardiologist that speaks so openly, so honestly from the heart, how disenchanted he was about getting in the medical profession. He's a very smart individual. He's a physicist whose parents encouraged him to become a physician. He becomes a cardiologist. And all of a sudden he realizes, holy moly, is this really what I got myself into? What is true medicine, he's saying throughout the book. He's given examples where he's being taught, in order to be financially solvent in medicine, you have to test your patients. You have to test them up the wazoo at times in order to make up for the lost profit, the lost revenue that insurance reimbursement has. And he's constantly questioning, what the hell did I get involved with? I did not get involved with medicine to just test patients and sometimes even cause pain and unnecessary testing and unnecessary treatments just so I could make a decent living. He's such a good writer. He's an honest individual. And this is a quote that came out of it. Did I really want to become another private practice grunt, over-testing, kissing ass for referrals, fighting insurers to get paid? I've never heard a physician so open and honest that articulated sometimes what I felt in my years of practice. Did I really get involved with optometry? So I just test and do more tests and more tests just so I could make up for the lost revenue through the years where my reimbursements have been cut sometimes in half. Sometimes in half. Did want to make this up with volume? And the answer is obviously not. So I encourage you to get this book. A lot of the information that I'm going to give you came from this book. And then really to kind of solidify it is Ernie Bowling. I don't know him personally. I've corresponded with him once. But I love what he writes. He's the editor of Optometry Times. Again, he wrote this article, What Kind of Doctor Do You Want to Be? And that's really just so pointed to success. You may say, oh boy, this is a lot of fluff. But let me tell you, this email announcing today's talk went over to 1,000+ practitioners. You know, at the end of the day, tonight, we may have a dozen, maybe 24 of you listening to me. And of those 12 or 2, I'd say less than a handful are going to follow through. And that's where the opportunity lies. You know, if you take the time to listen to me, take the time to believe me that what I say is from experience. I have nothing to sell you here. I'm going to talk about my workshop, yes, but other than that, there's no residual revenue I get from speaking to you tonight. And basically, what Ernie says is focus on the craft and your relationship with your patients, since this is something you can control. And that's so important, because in social media I hear everybody voicing their grievance on everyone except themselves. And basically he finishes up his article by saying, what kind of doctor do you want to be? And I'm here to tell you, I'm here to walk you through it. You decide, as corny as it may sound, and you follow through. And there are several benefits that I've reaped from following through on this advice. So that's where this talk has come from. So we started our practice about 30 years ago, 1988. We opened up cold. My partner and I, Barry Tannen, opened up just with ambition, just like Melanie talked about. We had ideals, we had experience, we had some false confidence, if you will. Here we are, shaking hands with the mayor of our township, grand opening, not having one patient record at the time. And we're dating ourselves because that's a Ninja Turtle. You could see our sign above looks weathered even when we opened. But man, our enthusiasm for private practice has never waned. I think it's stronger now than it was in '88. And that's how we looked at that time. And then 4 years later, we were so darn happy because we were still in practice. We basically, everybody told us, listen, to open cold, you have to starve. If you're going to open up cold, you have to accept all these insurances, and it's hard to get on these insurances. And in 1992, there was only about half a dozen. And we not only made it, you know, with the help of Gary Gerber and his consulting group, we really prospered. I mean, there wasn't a day that we starved between '88 and '92. It wasn't a straight line. There were a lot of hard times in there, but for the most part, we fed our families, we fed them well, we paid off our mortgages, we provided a very good living for our families. And here we are, literally almost 30 years later. Our partner Ivan Lee joined our practice 15 years ago, and basically he's a full partner, and we all are experiencing the same quality of life that we did back then. But it hasn't been a straight line. So what's unique about our practice? Why am I speaking to you today? We have a true multidisciplinary practice that I dreamt about when I started 30 years ago. We do corneal reshaping, we do specialty contact lenses, vision therapy, medical treatment. You know, up to about 10 years ago, we had an in-house laser where we did LASIK surgery within our office. Of course, we have the staples of optometry, of eyeglasses and contact lenses. I think what's unique about our practice is we dropped all our eyeglass plans back in 2001. So that's 15 years ago. So VSP and whatever was available at that time, we dropped them and never looked back. We accept very minimal medical insurances. Right now we accept a total of 3. This is very different than 2001. We were up to almost 50. And we said, darn it, we are not happy. We were all on that treadmill, basically seeing patients We were very efficient at it. We started with one exam room in '88. Then in '92 we built 2 exam rooms. Then in 2001 we built 6 exam rooms, and somewhere in between we added a 7th exam room. And we had 1 pre-testing room, and then 2 pre-testing rooms. So we had the capacity to literally see 6 patients every 20 minutes, 6 exams, and we were able to fit checks in there. So I'm here to say that we have been on the treadmill, and I'm happy to say we got off the treadmill 15 years ago and never looked back. So we have no eyeglass plans, minimal medical insurances. We have a staff training system. The quality of our lives in practice are parallel to the quality of lives of our staff. And a lot of times what I hear from practitioners are problems with either cash flow or staffing. And we encountered them several times over between '88 and 2001. But we made decisions to change that. I'm happy to say we did. The other thing we've had is consistent profitable growth through 2 decades and almost 3 right now. I can't say every year has been breaking numbers. And I have to be honest with you, some years we're at a loss. But overall, the trend has been upwards and continually has been upwards. So at least heed my advice that what I'm telling you today is from experience. It hasn't been Disney World every day, but I have to tell you, it's been worth the ride. And we have an exit strategy. What I mean about exit strategy is when Barry and I, and now Ivan, started the practice, we know exactly when is it going to be sold, to whom is it going to be sold, are we going to stay on the practice? You know, sold means our responsibilities will change, but all 3 of us really enjoy being in the practice every day. And this is this quirky dentist called Patty Lunn that Barry, my partner, brought into the practice, his philosophy, his tapes, his books, back in 1998-99. He's an Australian dentist. They came up with this kooky philosophy, seemingly kooky. By developing a happiness-focused business, I think it's possible to enjoy business, make a healthy profit, and die feeling that all the time spent in the business world was not wasted, but an integral, important, and fulfilling part of the life. We've embraced Dr. Lunn's philosophy over the past 15 years. We've worked very hard not only to make a profitable practice, but a happiness-centered practice. What the heck does that mean? That means, I got to be honest with you, every day I go into the office, to this day, I am just as excited, if not more excited, than I was when I first started. It doesn't mean my days are problem-free. My days are just like you. Sometimes 99% of my day are fires. But that doesn't stop me from enthusiastically entering the office every day. Now, that doesn't happen by accident. That happens by orchestration. So, I always talk in my talks about this inflection point. An inflection point is a time in our business where we have to make a decision. And most of us, when we hit this inflection point, we make no decision. In other words, we decide not to decide just by inertia. And we just let the currents take us. I got this inflection point concept from Andy Grove, one of the co-founders of Intel. And he wrote this book, Only the Paranoid Survive. And I read it almost 15 years ago again, and I realized I was approaching this inflection point very passively, basically saying, hey, I don't know what to do, so I'm not going to do anything, or I'm going to ask my competitors or the salespeople, what should I do? So what are inflection points in optometry? They're basically online contact lenses. They're these box stores that sell good quality glasses now, maybe made good quality, but I got to tell you, they have great quality ODs now in them. It wasn't when I started 30 years ago. The ODs that are practicing there are my friends and colleagues, and they're high quality. So that has changed. Discount eye exams, discount LASIK. You know, this is from my Sunday paper, $2.99 LASIK per eye. This is a surgeon, very good surgeons across the street from me. If you have LASIK surgery in April, your friend will get it free. And the most insidious inflection point that all of us has gotten sucked in at one time or another is managed care insurance reimbursements. We all feel in order for us to be busy, we need to accept insurances. No matter how lousy they pay, we'd rather see a low-paying insurance, most of us, than see no one at all. And I have to say that's wrong. I think 30 years ago when I started my practice that being busy was equating to being profitable. Right now, I have to say it's inversely proportional. It's paradoxical, as a matter of fact. The busier I am, the less money I'm making. And you could say, how can you say that? I think if you stop and really think about it, you'll see, you know, he's probably right. I've noticed I kill myself some days. I see patients literally from morning to night, and I'm busy. It's one of these days I'm hopping. And I look at my journal and say, holy moly, you must be joking. Is that it? And there are other days where I used to have, which were slow because of canceled patients, because of snow or inclement weather. And I look at my journal and say, holy moly, we did really well. How could this be? Well, it could be, just as an aside, I had time to spend with my patients. Maybe the patients who showed up those particular days are my loyal, what I call A patients, the patients who came to see me because of me, not because I was in the insurance book. And that allowed me to establish my relationship with my patient, solidify it, and that translated to them following through on my recommendations. I actually had time to recommend. So the pivot point, the inflection point tonight is, are you going to view these things as opportunities or challenges? Almost all of us look at this as challenges. All of us. Reduce medical insurance reimbursement, EMR, vision plans, discount lacing, prescription flight, discount centers, and most recently, online refractions, contact lens, eyeglasses are getting a lot of buzz in social media. These things in our practice don't even raise an eyebrow because we decided 15 years ago that we're not going to be sheep. We're basically not going to do what everybody else does. Is that easy? No. But if it was easy, everybody would do it. Again, it is a Tuesday night. We send out flyers to thousands of ODs and practitioners. Not even 24 are going to dial in tonight. How can that be? There's got to be at least more than 2,000 people right now, as I'm speaking, on social media, pissing and complaining about something. But yet, when it comes down to learning, what does it really take to be successful in life and in private practice, they're not dialing in. Because you know what? They know the answer. Well, they don't. You just have to trust me. So when I talk about my practice, our practices have evolved several times over the past 30 years. And this is our current building. Barry, Ivan, and I built it again over 15 years ago. We're very proud of it. But that's not what we view our practice as. We view it as this. We view our practice as this building, this business that's built on pillars. And each pillar is a profit center, whether it's contact lenses, eyeglasses, medical billing, medical optometry, vision therapy, you name it. And I'm telling you, about 15 years ago, we noticed some pillars are much stronger than others. Even back then, we knew, for example, soft contact lens replacements is a very brittle pillar. And while our colleagues were trying to figure out how are we going to combat this, are we going to do private label contacts? Are we going to resist faxing back the patient's prescription and calling them up? Are we going to meet or beat the prices? You know, those are all inflection points, and they're all decisions or non-decisions. Our decision to that inflection point was we're going to give the soft contact lens prescription to our patient just like we do our therapeutic prescriptions. That's how we dealt with that inflection point. So it was a very different mindset. we figured this knife is dropping, it's not worth catching. We are going to focus on some pillars that we know in our heart is going to keep this building afloat, not only for ourselves, but for our staff and their families who depend on us. So when you look at your practice, change your mindset. Look at it as this building, this business that's built on pillars. And the pillars are going to change throughout. The pillars I'm going to discuss with you tonight are not going to be as strong 20 years from now, maybe not even a year from now. It doesn't matter. Your practice, my practice is built on multiple pillars. The question is, do you have enough grit? Do you have enough guts to focus on the pillars that you know in your heart are going to sustain your life? So this is our practice today. We worked very hard to establish a practice where the pillars are specialty contact lenses and corneal reshaping, vision therapy, eye exams, and medical testing, and down on the bottom is contact lenses. LASIK is nowhere to be found at this point, at this current point. Now, if I showed you this graph maybe 15 years ago, it would look totally different. Corneal reshaping and specialty contacts were non-existent. Vision therapy was dabbling at the time. And most of our revenue, 10, I would say 15, 20 years ago, was from materials like glasses and contacts, not even exams. So even though we were wet behind the ears, we knew something's wrong here. If most of our profit is occurring from materials, something is wrong. We better change things around. So lesson number one is build your practice with yourself in mind. No one ever talks about this. We all talk about building a practice that makes us money. And there's nothing wrong with money. That is quantitative. It's why we're all practice. If our practices did not support us, we would not be in practice. This is not a philanthropic venture. However, I'm here to say that if you focus on making sure your practice feeds your life, profit is just a side product of it. It's bound to happen. Unhappiness is not knowing what you want and killing yourself to get there. So a lot of times I'll speak to my colleagues, they're working 6 days a week. They're overwhelmed with constant barrage of problems from insurance companies, from staff, from patients, and they just feel like their practice is running them, that they're not running their practice. I felt like this. In 1996, I could tell you that we were grossing multi-million dollars at that point. You think I worked so darn hard to get to that stage, and I could speak for all of us, staff and doctors, we were miserable. But somehow I was so busy being on this treadmill, it took a staff member to say, Dr. D, we increased our capacity from 3 exams an hour to 4 exams an hour with technology and staff, but I noticed our numbers are the same. I didn't notice that. I was into being busier. I was being, more efficient, more techs, more equipment, more billing. I just didn't have the time to stop, to get off this metaphoric treadmill, to say, what the hell am I doing? I am miserable. My patients know I'm not giving them care. My staff is miserable. What does it mean even if I am making money? I know it sounds corny, but it's valid. It's the majority of reason that Johar wrote this book, Doctored. It's the majority of reason you get this kind of negativity around medicine, not just optometry. We are blessed to have one of the best professions. To this day, I strongly feel optometry is the best profession for quality of life out there, bar none. The question is, how do you practice? So we changed our mindset in the late 1990s to say, you know what? We have these governing values. Our governing values I'll describe shortly, and we're going to build a damn practice that's going to feed those values. It doesn't mean, again, that your practice is Disney World every day. You know I would be lying to you if I said your practice is going to be happy every day. But I have to tell you, my staff has been with me, most of them, for over a decade, some of them over 2 decades. They're not there for the money. They're there for the quality of life my practice produces for them. Ivan has been my only partner in 15 years. It wasn't this churning out of ODs. He joined the practice in 2001. He has stayed there today. And we've all enjoyed a common, well-financed lifestyle because of the attributes I'm giving you now. What you have to say is Nick is right. He is selling me something that no one's going to buy into. Happiness-centered practice. If I was talking about a new machine, a new diagnostic machine, this webinar may blow up, or a nutraceutical, or a new way for billing or coding, or perhaps an oral pharmaceutical lecture. This webinar would be blowing up. A happiness-centered practice? Nah, I don't know if it's possible. I don't give a hoot. I'm too busy to even look into it. It's not for me. So how do you define success in practice in life? Is knowing why you're in it. It's more than just generating income. We're all making about the same amount of income, give or take. You know, it's not like someone's making millions and we're making 50,000. You know, within a good range, we're all making the same amount. The difference is the quality of our lives is significantly different. So understanding what you value most in life and knowing how. In other words, confirming that every day you make sure you're practicing the way you value yourself practicing. So in our case, we value helping and caring for patients. If I don't feel at the end of the day I gave my best, I don't give a hoot if it was the most profitable day. We've all had that day where, man, we didn't even look at our journal, where we may have made boatloads of gross that particular day, but it was a crappy day. We just know it was a crappy day because our staff wasn't happy, or you just knew you weren't practicing the way your gut was telling you should practice. You can lie to everyone, but you can't lie to yourself. Number 2, respect. I totally went into optometry in healthcare to be respected by my family, to be respected by my peers, to be respected by my patients, to be respected by my staff, my colleagues. And what happened when I was so busy, I was respected by no one. My staff thought I was an idiot because I was running my practice like an idiot. Insurance companies certainly didn't respect me because they were treating me like a pawn. They were telling me what I should get reimbursed for procedures I was agreeing to, how much time I should spend with a patient. My patients weren't respecting me because they knew I wasn't giving of myself. I wasn't asking about their family. I wasn't really spending the time to articulate why I'm recommending a particular eyeglass or a referral to our glaucoma clinic or whatever the case may be. I was just running from room to room to room on this, metaphoric treadmill. So I wasn't getting respect. My quality of life, no matter how much revenue we were generating, stunk. Why? I was getting home and I felt the majority of my day is spent in my practice. Majority of my life is spent in my practice. And if my staff is not happy and my patients are not happy and my partners are not happy and I'm not happy, the majority of my life is not happy. And income. I think there's nothing wrong with talking about income. For some reason, people disassociate being happy with being profitable. And I'm here to tell you, the reason we're successful is we're not sheep. It's not easy bucking the trend, but it is worth it. So lesson number 2. This is the author, David Allen, from Getting Things Done. It's an old book. He's written several since. I recommend you get it because I manage my time, but more importantly, I manage my life. He says, you can do anything, but you can't do everything. And somehow in optometry, maybe ophthalmology, definitely ophthalmology and in medicine, but certainly in these subspecialties, we think we can do anything, so therefore we can do everything. The question, the answer is, the fact is, you can do everything, but you can't do it well. My good friend and consultant Gary Gerber says, that what would you rather have? 1 million patients pay you $1, or one patient pay you $1 million? I never understood that. He has said that from the first time I met him. I never understood it. He laughs. I don't get the joke until recently. What I understand from that phrase is that if you can only see one patient, and that patient pays you $1 million, it would be a lot easier to see one patient than 1 million patients. But you have to ask yourself, why would someone pay you $1 million? Why would someone see you in particular as opposed to someone in the book? It's because you're offering something unique. You're offering it in a way that nobody else can offer it. And that's what I learned. Lesson number 2 is I can do eyeglasses, but probably not any better than any of you listening to me. I can fit a soft contact lens really well, but probably not any better. Ocular disease, I'm pretty good at it, but I'd venture to say many of you and many ophthalmologists are better at it or equally as good. Vision therapy, now we're talking. There's not many of you out there in optometry or ophthalmology doing vision therapy. So that has what I refer to as a high barrier to entry. And that's why Barry and I really have focused on that. It fulfills our values. We get respect. We get unique caring. It's not easy. It's not everyone's going to do it. Now, as a matter of fact, 99% of eye professionals are not going to do it. And that's why we've decided to focus on that. Orthokeratology, again, no matter how much I lecture on it, how many patients visit my practice, very few can do it. Why? Is it because the lens is so hard to fit? Hardly. I've been doing this for 20 years. I'm going to tell you, it's as sophisticated as fitting a soft bifocal fit. Not a soft toric bifocal, soft bifocal. So technically it's not that hard. What's hard about it is patient management. What's hard about it is structuring your fees about it. What's hard about it is presenting these fees. What's really hard is making a conscious decision, putting a stake in the ground and saying, this is what I'm going to focus upon. That's what's hard. It's not the technique. Specialty IOLs, we know ophthalmologists who are focusing on that. But yet they're still doing maybe contacts and glasses and medical ophthalmology. And a lot of them are doing VEGF injections, even though they're not retinal specialists. So you could see they're all over the place. And again, so they lose focus, and obviously LASIK. So can we do all of these? Yes, but we can't do them well. So a staff member comes up to me. Her name's Jen Mullen. She's been working for us for over 20 years. She's our head vision therapist. She goes, Dr. D, I got to tell you, I don't even know what direction we're going to in our office. This was several years ago, but it wasn't too far off. And she likened it to these ships. And she goes, you ever on a dock and you see all these ships and they're docked and they're all pointing each way and you're wondering how the heck they get out of there safely. She goes, this is how the office feels to me sometimes. We're doing dry eyes sometimes, and now everybody's getting punctal plugs perhaps, and maybe meibomian gland dysfunction and Demodex. And she goes, the next year or the next month we're talking about the value of OCTs, and we have to do baseline OCTs when there's a glaucoma suspect, and we have to talk about macular degeneration to our patients, and perhaps nutraceuticals, and then we have to talk about vision therapy, and then we have to talk about myopia and the myopia epidemic, and the other day we have to talk about this new progressive that's available. She goes, it's like these ships. I know they're all important, but I got to tell you, the staff doesn't know which way we're directed. So she actually comes in my office and she goes, this is how our practice should be. It's like a luxury liner that's going one way, and everybody's on this liner, and everybody agrees this is the way to travel. And that metaphor really changed my life, because I said, she's right. Even though I lecture on this, we're still fragmented, probably better than 90% of ODs and MDs or OMDs out there. We're still fragmented. So a model of success that I've come up with and have trained literally hundreds of doctors who had the grit to follow through is focus on one specialty that has a high barrier to entry. And that doesn't mean what I chose. That means what you choose. But if you choose, let's say, glaucoma treatment, in my estimation, only mine, I don't know how high that barrier to entry is, because OMDs and ODs now are crowding it. I have a lot of success stories from CRT and Ortho-K wearers. I don't have one from people that I've saved. I've saved their lives, for goodness sakes. And they may thank me, but they're few and far between. I get success stories weekly from our specialty care patients, whether they're scleral lens or RGP lens, keratoconic fit, parents of Ortho-K children who they know I've stuck with them for the past 10 years or more, vision therapy, traumatic brain injury patients. I don't get them from soft contact lenses. I don't get them from eyeglass wearers. And so it's very hard for me to differentiate myself. Another criteria is this profit center profitable? So there are centers where I've noticed that, yeah, I can exercise my need to be unique, but that center, no matter how hard I try, is not rewarding me financially. So therefore, I kind of self-destruct. So I need the values that I set. I have to be financially rewarded for all the efforts that I put into it. And number three, as I stated, confirm this specialty fulfills your value as a healthcare provider. So in other words, if you take on a subspecialty, if I, for example, take on dry eye treatment, and I say, I'm going to do this because I have found out through colleagues it's very profitable, with insurance or without. And I buy instrumentation, and I discuss my meibomian gland dysfunction and warm compresses and maybe lipoflow or whatever the case may be. And I got to tell you guys, it doesn't do it for me. Dry eye for me just doesn't do it. So even if it rewarded me financially, it's not where my buttons are pushed. By the way, some of my partners really enjoy it, but for me it doesn't. So if I took on that subspecialty and say, you know what, darn it, I am going to do it because it's going to make me successful, it won't. So orthokeratology, when Barry introduced it, oh man, long time ago, I said, are you crazy? Because he said, listen, in 1992, when the first reverse geometry lens came available, he says, listen, I've heard some anecdotal stuff that this is not just flattening the cornea, it's a lot safer. He's functionally based. He says, I get this anecdotal data that it's stopping or slowing down progression of myopia. And I remember saying to him, okay, but I don't want anything to do with it. Nothing. I think hard lenses are obsolete. This was 1992. I think putting a hard lens in a child's eye is barbaric, and I will support you, but I'm not going to get involved. And he said, okay, you know, how times have changed. We're not crazy. I'm here to tell you we're not crazy. We're just eccentric. We're crazy enough to believe that if we truly feel in our hearts of hearts that we're helping patients, that we're going to go with it, no matter if not everybody else is doing it. So this is my crazy staff. Most of them have been with me a long time. We're not that crazy. We may look crazy, but you got to trust me, we're not. So why has orthokeratology I'm telling you, prospered in my office? I personally see patients, direct care, 3 days a week. I have been seeing patients since my power practice consultant has told me 2 decades ago, Nick, you're killing yourself. You're on this treadmill. You don't need to be working 6 days a week. Work 3 days a week. So I work 3 days a week. That doesn't mean I golf the other 4 days, but I could if I wanted to. Why have I decided of those 3 days a week, I personally see Ortho-K patients 2 of those days? Of the 3 days, I see patients, Ortho-K, 2 of those days. Ivan, my partner, he works 3 days. Guess what? He sees Ortho-K patients 2 of the 3 days. So that means in my practice, we see Ortho-K patients 4 days a week, all Ortho-K. Why? Well, high barrier to entry. I am talking right now to less than 24 people. I am telling you, I don't know how many ODs and MDs there are in the U.S. and abroad. I am talking to 24 people. If you guys, if one of you just listens to me, it is worth it. Why? Because I am telling you, there's so many rewards. I've seen it not only in my own practice, I've seen in practices throughout the world. There's just one thing needed. They have to share my values. What value? I am going to listen. I'm going to have enough guts to find a subspecialty that has a high barrier to entry. Number two, it's profitable when my fees are set intellectually, intelligently. And number three, it fulfills what I value as a doctor. In my case, in many of cases, respect, autonomy, appreciation, and I know in my heart I'm uniquely helping my patients. That's it. If only it was easy. It's not. If it was easy, probably everybody would do it. But I have to tell you, it's that simple. So in 1993, I had one patient that Barry fit. He was a police officer, and when Paragon got FDA approval, our practices just started ballooning. And it hasn't stopped since. So, like I stated, the majority of my practice, and you can see that says 2004, so these children right there are no longer children. One of them has had LASIK as an adult. They're in their 20s on the top. They were straight ahead. And the other one graduates Stanford, and I don't know what he's up to, but he's still wearing the lens. So you do the calculation. The reason I do this is I know everyone in this picture, whether they're wearing the lens or not, they're still my patient. And their children are going to be my patient. Why? Is it because I do a better refraction than most in my area? No. It's they know I care. They know whomever's seeing patients in my office cares as much as I do. I get my buttons pushed by seeing these children become adults and then bring their children to me. It's that simple. So now, although I have a much nicer dispensary than I did in 1988, I have to tell you, the main focus in my office today is the conference room, because that's where we discuss the specialty care, whether it's scleral lenses or it's toric RGPs, all the lenses that I poo-pooed in 1992, I've become an expert in it. Why? Because I realize the majority of my colleagues have not, so I'm uniquely positioned to talk to my patients, to tell them why I can fit them, why I can service them, why I can care for them better than most out there. So this consult room has enlarged within our office compared to 30 years ago. We've gone from 1,200 square feet in 1988 to over 5,000 square feet and growing. So here I am, 30 years in practice, Barry 30 years in practice, Ivan about 2 decades in practice, and we're going to take on a 4th partner, and we have a certified resident within our office, and we have a very thriving practice. What do we talk about? What's our 1-year goal, 5-year goals, 10-year goals, 20-year goals? And they include profitable growth, not numbers. We're not on the treadmill. We're on how is this practice going to continually feed our lives, our happiness in life? It's a very different mindset. Most can't comprehend it. If you're one of the few listening to me, you have that mindset. That title was there on purpose. If I said how to build $1 million business or $1 billion practice, $1 million practice, we'd have maybe double. You know, if I started saying, hey, how do you just make boatloads of money? I'm telling you, people would dial in. Even if they knew I was deceiving them, they would dial in. It's people who want practice autonomy that are the ones that have the courage to make the change. Success secret, number 3, is you need grit. This stuff is so damn simple. You can't believe it works. You just have to trust me. I have no reason to lie to you. But man, it's not easy. It's simple. It's just not easy. You need something called grit. And about 5 years ago, I listened to Dr. Angela Duckworth. She just came out with a book called Grit. And she is a professor at University of Pennsylvania. And she says grit is living life like it's a marathon, not a sprint. So all our colleagues who want instantaneous gratification, they want continual secrets to success. It's not there. We all know that. Whatever you're successful with, whether it's physical success, marital success, parental success, business success, it's not easy. It takes persistence. There's no secrets. The only secret is grit. And the other secret is by her colleague, also a PhD at Stanford, Carol Dweck. She talks about this growth mindset, that always knowing, I'm going to fall, I'm going to trip, but I'm going to learn from it. You see, most of what I do in my practice fails. I'm not here to tell you everything I touch turns into gold. I'm here to tell you the majority of things that we do fail, but we try to learn from each failure. But we fail forward. We're constantly saying, okay, did not work, we tried it, let's fold up, let's keep focusing on what's working, what's worked. We listen to our staff. We follow through. Even if we know that our staff may be wrong, we don't know that for a fact, number one. Number two, they know that we're listening, and we applaud their willingness to put themselves out there. So grit is perseverance and passion for the long term. It's not like, rah, 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 I'm going to do it, and then change channel the minute the rep comes in and says, I have these soft contact lenses, and I only have them for a select few practices, and therefore I've chosen your practice, but you need to produce by promoting these soft contacts. That's just, attention deficit. It's not when a vision plan says, hey, listen, we're going to pay you $2,500 for this specialty fit. I'm not saying there is a vision plan that does that, but let's assume it. Are you going to jump for it? Does that sound good to you? You may say, yeah, I guess so. But you haven't learned the secret of chair cost. You haven't learned the secret of really intelligently developing fees. It may or may not, but I got to tell you, it's not equally good for everyone. So growing a sustainable, profitable practice comes down to three things. Knowing why you're growing the subspecialty. That you got to know why. If it's just for finances, stop right now. Two, it comes down to passion. You hear it in my voice. I am passionate about private practice. I'm passionate about life. Optometry has given me, my family, my partner's family, and my entire staff a quality of life that 99.99% of the world can only dream about. Why? It feeds my values. And number three, damn it, I do have grit. I have fallen down. My partners have fallen with me. And we have fallen and gotten up and fallen harder. And when we got up, it feels like we got run over by a Mack truck. And yet we still get up, we brush ourselves off, and we keep going. Because that is private practice. That's small business. That's big business. And if anybody tells you otherwise, they're lying to you. And I love this quote by Steve Jobs. I am convinced that what separates successful entrepreneurs from the unsuccessful is pure perseverance. And I have found that to be the case of practicing and knowing many of you out there personally. The ones that are successful may or may not be the smartest. They may or may not be the most business-wise, but they are the ones that just don't give up, period. They are the most happy. So, why isn't everybody doing Ortho-K? If Nick says he's only working 3 days a week and has more than a great living, why? I got this email. I was preparing this talk. At 7 o'clock, I was going over my notes. Get this email, subject line, urgent. Open the patient portal, says, Dr. D, after we visited yesterday for a corneal reshaping checkup, Renee complained about persistent headaches. She left my office about 5 o'clock. It was snowing. Remember it, she was my last patient. She came in with a sibling. It started as soon as she put on her CRT lenses last night. This is someone who's been wearing CRT lenses for at least 5 years. She had the headache all day and is quite concerned about putting them in tonight. Please help. So this is late at night. Years past, I get an emergency phone call. Most of you couldn't handle this because it's like, you must be kidding. We just cleaned the lenses. I didn't change them. All we did is clean them with low bob, rinsed them off, stored them in Boston. Patient went home. Now she has a headache. So How are you going to do this inflection point? I get this every day, guys. It's not for the weak at heart. The way I did it is I pick up the phone, said, Mrs. Jones, I really don't think it's the lenses. Was Renee's lenses blurry or eyesight blurry? No, actually it wasn't. I said, I have to tell you, when your husband brought her in yesterday, I said, Renee wasn't looking that good. And he said, she took a nap, a 45-minute nap on the way in. They travel to my office from Manhattan. I'm in Hamilton Square, New Jersey. That's a 1.5-hour drive. Mass transit, again, at least an hour and a half. Yesterday, it was snowing here. Not a lot, but enough for my primary care schedule to clear out. Barrier C in primary care, I was seeing corneal reshaping patients all day. I remember saying she slept. Okay, maybe that's why she doesn't look well. And I said to Mrs. Jones here, I said, listen, Renee didn't look good. Could it be she's coming down with a cold? She said, I didn't even think about it, Dr. D. She didn't complain about her eyesight. So she asked Renee, Dr. D is on the line. How's your eyesight? She goes, great. I said, Mrs. Jones, I don't think so. What I would do, if she still has a headache tomorrow, call the pediatrician. What does she say to me? She goes, I got to tell you, you're the best. All you did, I send you this email. I don't want to bother you. You call me up. My pediatrician doesn't call me up. I'm still waiting for the pediatrician to call up because I think you're right. I think she just has a cold. That's why I travel all this time. So she didn't say, I travel because you're the best CRT fitter or the best Ortho-K fitter. I didn't travel because you're some wonderful optometrist. I travel, and her sibling wears them, her other son wears them, because you care. And that to me makes up for me taking away time for my family to pick up the phone. And that leads me to my last lesson, is fear versus faith. I have found from doing this for a long time, what stops everyone from taking action is fear. Fear of patient loss, fear of failure, fear of bankruptcy, fear. And the bottom line is, I love this quote, love it. People feel much more responsible for the decision they make actively than if they choose to do nothing. And what does that mean? I interpret it as meaning, listen, most of us decide to not decide, and therefore we're not accountable for our decisions. Everybody else is. It's the insurance companies. It's Nick's fault. It's my patient's fault. It's the economy. It's online refractions. It's whatever. When you make a decision, you are held accountable for that decision. I'm here to say, have faith that you will make mistakes, but your successes will by far outnumber your mistakes. Don't be afraid. So, is it really possible? Yes, if you do a few things. You confirm that your values are aligned with your daily actions. Number 2, you can do anything, but you can't do everything. And number 3, you need laser focus, persistent focus. You need growth, you need a growth mindset, and you need grit. And you have to decide, are you going to come fear? Because I fear every day. I listen and I read about these generals and these high-level martial artists and these politicians, and they say they have fear every day, every moment, but they take action in spite of fear, not in lieu of fear. Anybody who says, I'm not afraid, is crazy. And then at the end of the day, all of you are going to ask me, well, how much do you charge for? That's why you need to really make a commitment to learning how to properly charge for any service you provide. You can't answer that in a webinar. I don't think you could answer it properly in a talk. So I'm here, this webinar was here mainly to convince you to come to a workshop called Vision by Design. I've been going to this symposium since its start. This year it's in April. It's in Scottsdale, Arizona. They talk about specialty contact lens fitting. They talk about orthokeratology. They talk about myopia control. They give workshops. They give boot camps. But most importantly, everyone there is like-minded. I remember when I was doing a VT residency, again, in 1986, 30 years ago, I went to my first COVD meeting. And that turned my buttons. I was around like-minded people. I was around people who just didn't think like everybody else. I encourage you to go to this meeting, this continuing education credits, but I'm telling you, the number one value that you will get out of attending Vision by Design is being around people who are not afraid or act in spite of fear. They will instill confidence in you. Like me, you'll see it's just not Nick Despotidis. There's several hundred attendees that will say, hey, yeah, I did it. I love it. I'd never go back. And you talk to them and you gain momentum and then you learn the skills. And then all of a sudden you have teammates. You're not around negativity anymore. So I strongly recommend that you go to www.orthokmeeting.com, look at it, but more importantly, decide to attend the meeting. And lastly, during that, I give a workshop. It's a long workshop, 6 hours. I devote myself to that workshop. If you go to my website, www.superchargeyourpractice.com, you'll read testimonials from attendees who are talking from the heart. And here's one that I received lately for someone who's come twice. I don't know Mindy personally, but I remember her coming up to me after the first one. I've been to your seminar twice. First time just to see the hype. And boy, was it good. And the second time to actually buckle down. We all know what we need to do to get our practice thriving, but we're all afraid to put into action our thoughts. Your seminar gave me the confidence to do what I needed to do. After my first seminar, I went back and within a year, listen to this, guys, I dropped all vision plans except 2. I said, I'm done working for pennies. My staff thought I was crazy. But we actually increased that year by 12%. Just think about what she said. And I'll double down and say, listen, Gary Gerber, I mentioned him. He doesn't pay me. I pay him. He told me this over 20 years ago. Nick, you can drop 90% of your insurance plans, and I promise you, you'll make the same amount of profit or more. I just didn't have the faith to follow through until much later on. She goes on. The second seminar I attended because I actually wanted to get my Ortho-K practice into gear. I now have the confidence to know I can build the practice of my dreams without working so hard. Thank you, thank you, thank you. My staff thanks you too. Look at that. My staff thanks you too because they don't have to deal with those crappy vision plan patients anymore. Mindy Nguyen. Again, I encourage you to take action. I thank you very much. I hope you at least follow through on my recommendation, and I hope I get to meet you personally one day, and please come up to me. On that, I hope you guys have a great night, and good luck.